Hi, everybody. It's me, Dr. Christina Hibbert, and I am here to do my very first, very simple introduction to using essential oils for maternal mental health clinical practice. I know many of you have heard me talk about this either in person at the Postpartum Support International Conference or seen me online talking about it, but it's definitely something that I have really enjoyed and found very useful using in my clinical practice with my clients. And it's also something that I am passionate about educating other clinicians about, because whenever I seem to connect with other clinicians, they always have the same questions, which are, I've thought about doing that, or my clients use essential oils, or I use them, but I've never used them in my practice. But how do you do that? And how do you do that ethically? And how do you do that in a way that's non-threatening, or isn't going to push the client or doesn't feel like you're selling anything? And how do you do that in a way that's research-based and backed up, and that you feel comfortable in recommending these sorts of products or additions to treatment the way I like to see it? So we're going to just touch on a few of those things today. Very, very simple, very short. And I will hopefully get you started in thinking about how this might work for you. And then I want to really focus in on the next few times on, taking questions from everybody and really getting more specific into what you can do. So first and foremost, I just want to say that essential oils are a highly validated form of addition to treatment for many types of medical and mental health issues throughout the lifespan, from infancy throughout the end of life. And specifically, I want to talk about pregnancy and postpartum, because there's some really fabulous research, and the research is clear that these work. And there's different ways that they work, and I know that a lot of people are skeptical about whether essential oils work or not. I totally understand that. I've been in that same boat myself. And I know that personally I've seen them work for me and for my family. We've been using essential oils for about 7 years now, and we have been really impressed with the results that we've had in so many different ways. For me, it's actually helped me to make over, in a sense, my family's medicine cabinet, to have options to turn to for things that might not even have a medical option. Like, if you get a bug bite and that bug bite is really itchy, you can use an anti-itch cream, but it doesn't always work. So you can use a little lavender and it works beautifully. Things like, helping my kids with dandruff, use a little melaleuca in your shampoo and that can work wonders. And really what sold me to begin with was a product called On Guard by doTERRA, which is the protective blend for any other types of brands. And it really, really helps us. I mean, just as a personal account, it really has helped us to knock out any kind of scratchy throat or cold as soon as we get it coming on. So as soon as I have a hint of that, I start downing that. I've added in some oregano and peppermint and lemon. And yes, you can take some of these oils internally. They're totally safe. So, it's about learning what the oils are, how to use them safely, effectively, and then just having that knowledge, you can share that knowledge with your clients. So think about it this way. If you were sitting in private practice, now I'm a psychologist, so I'm going to talk from my point of view as a psychologist. I know there's many out there who are in different areas, a doula, midwife, a physician, psychiatrist, whatever your line of work might be, you can tailor this to your needs. But for instance, if I'm sitting with a client who is postpartum and having a real hard time, is really struggling with, let's say, anxiety. Anxiety is a big issue. We know one of the most common throughout the lifespan for women in general, but definitely during pregnancy and postpartum, it can be a big issue. So if I have a client who's struggling with anxiety, of course, I'm going to use all of my clinical tools. I'm going to talk with her. I'm going to help her develop a relationship with me. I'm going to, maybe use some tools like cognitive behavioral therapy, a thought record, getting her started in that. I might talk to her about how to sit with the anxiety, how to feel it, how to deal with it, how to cope with it, teach her skills, and let her talk. And I might just sit with her and be with her and empathize and grieve with her, right? But also I'm going to recommend some things. So for certain clients, I might recommend, I really want you to go and see your physician and make sure that there's nothing going on medically. For instance, with clients that have depression, especially after pregnancy and postpartum. Make sure there's no thyroid problem or some other issue that's going on. So have they been to their doctor, right? You might recommend that they start on a medication for a client who is highly, highly, highly anxious. And I've had many like this who were doing therapy and were working for several weeks, and it's just not getting better. They're doing the skills and they can think more clearly, but the anxiety is just still at this really high level that's impacting their life. So then it's time that we have this conversation about medications, and do you want to think about medications, and here's what the research says about that, and here's what you can talk to your doctor about that. And I don't prescribe, so I don't go that far, but I do make recommendations on what they might talk to their doctors about, how they might go about it. To me, essential oils is along the same lines. You might recommend that they go and get a massage, because massage therapy is also researched and proven. Light therapy, especially, I live in a place in Arizona, actually, but up in the mountains of Flagstaff where it does snow and it can get gloomy, and people can have trouble with those seasons, including myself. So light therapy is something that I will recommend for clients to sit in front of a window for 30 minutes every morning and start to try to get that beautiful light into your system to help lift your mood. So there's all of these things we recommend, and that's the same thing that we would do with essential oils. So it's just another tool in our clinician toolbox to help those that want to participate to be able to add them to their toolbox as well. Now, of course, like anything else, all of those things I just mentioned, some people are going to completely jump on one or two of those things and disregard the others. Some people are going to try all of them because that's just how they are. Some people aren't really going to want to do any of those, and they're just going to keep on struggling and not really want to try these extra things that we're recommending, and they might not even want to keep coming to therapy. Everybody's different. So of course, we're not pushing essential oils as a treatment on clients. We're definitely not saying that it is the treatment, that it can replace or should replace any other kinds of treatment. It's just another tool in the toolbox. And some people are going to want to try that, and it's going to work more effectively for them, and other people not so much. So we just let that go, just like we would with any other treatment, right? So that's kind of the first thing to keep in mind. The second thing is, why would you hold back something that you know can be effective? And if you don't know it can be effective yet, well, that's why maybe you start using a couple of the essential oils and try it out for yourself, or you can do some research, or check out my free guide that hopefully will be available soon, and my book that'll be coming out soon, and read up on some of these things and look at the research and see what you see, and see how you feel about it. Because of course it has to be a fit for you too. This isn't something for everybody to include, just like saying one form of therapy is the right way for every clinician. That's just not the way it is, right? Everybody has to do what they have to do that feels right for you in your work and for your client as well. But once you get that, if you have that conviction, which, for me, like I said, I've been using these personally and with my kids for 7 years now, and they've been really highly effective for our physical and emotional health. And I started to realize just a year ago, why am I not recommending these to clients? Why am I not doing that? It's like not recommending exercise or nutrition. Those are such important things, and we might feel like we don't understand as much as we want to about how to help someone exercise. And of course, I have a solution for that. My book, 8 Keys to Mental Health Through Exercise. Just had to put that out there. Or we might feel like we don't understand nutrition very well, or we don't really know much about supplements. So we can learn more. And as we learn more, we can educate our clients. And that's what we're really doing. We're educating them on options. So that's kind of a second point, is that we really are trying to help them by giving them the education that we've received and not holding that back for ourselves, right? We want them to have all of the education they can about all of the different types of treatment. And then third, we are also able to bring that treatment into our counseling sessions. So for instance, I have a colleague who is a therapist, and she has been trained in EMDR. So of course she uses EMDR with some clients in her sessions. I have been trained in clinical hypnosis. I don't use that with every client, because not every client's going to want that or need that or respond well to that. But with some clients, it is highly effective. So I use that with my clients in sessions when it is appropriate and when they want that and when they want to participate in that. The same goes for essential oils. So one simple thing, I think the best way to get started when you're talking about using these clinically is just to get a diffuser. Now here is just one of the doTERRA diffusers, the Aroma Light diffuser. This is just one. You don't have to get them from any big company. Mine that I have here in my office is actually one that I got just on Amazon, just kind of a cute little one, has lights on it and things. So I have these all around my house, and I have one in my office, and we even have one in my husband's office. He's a dentist. So not just one, we have several in his office. So if you start with a diffuser, to see what the diffuser looks like, all this does is you put water in it, you put a few drops of the whatever scent that you want, whatever scented essential oil that you want, and here's a bunch of different options, right? And then you create a mood. So when I have clients coming in who are severely depressed, I might put in something uplifting like citrus flavored, like citrus bliss or wild orange and peppermint, which is a great combination that kind of works on focus and wakes people up and kind of helps you to notice, hey, I like this place. It smells good. It makes me feel comfortable. If you have someone who's really anxious, you might use something like Balance the Grounding Blend, which is very calming and centering, or something like lavender or Serenity, which is the restful blend, the calming blend, which helps to kind of calm down and reduce that anxiety without them even really knowing it. So what happens is when it diffuses into the air, we inhale that. And as we inhale it, it smells good. And so we have that aromatherapy effect, but also the particles of those oils actually can go into our body and work clinically as well. And this is what I'm talking about when I'm saying these work. So I'm going to explain in a few minutes just a few different ways that they work so that you can understand. And we'll talk more about this in other webinars, but this is just kind of a way to get us started. So we diffuse something, we can have the client's needs in mind, and that can just be in the background. So often when I'm doing this, most of my clients, when they come in the first time, they don't even notice. They might say, I like the smell, or it smells good in here. They don't even notice, but most of the time, because they're so focused on, oh my gosh, I'm in therapy and I'm going to be doing this. And I got to fill out paperwork and I'm talking about all my problems with this person I don't even know, right? But you're not only, setting the mood with this calming scent or this invigorating scent or whatever you want it to be, you're also creating an association. So if they enjoy that scent, if that's something that makes them feel good, and I use basic scents like that because the research shows that these work really well and most people do enjoy them. So something like peppermint and wild orange together, or just the wild orange, or just lemon, or something just clean like that and fresh, something that's very simple. Most people really do like that, and it does wake them up and it makes them feel happy. Then they associate therapy with that happiness that they feel from the scent. Okay, so they start to create an association with that scent in your office, and then when they smell that later, they might think, oh, that reminds me of therapy. That reminds me of the place where I go to get support or feel cared for or feel nurtured. And so down the road, that's where the diffuser can be really helpful as well. So number one is just to get a diffuser, simple diffuser, put it in your office, and then get 2 or 3 oils that you want to try, that you like the scent of. I mean, it's great if you like it too. A lot of my friends and colleagues have been using essential oils in a diffuser in their office, but it's interesting because one of my colleagues and friends said she's been using it, but really she uses it more for herself. So she'll diffuse something, but she likes the scents of those. So she'll diffuse what she wants to smell, and then it does help the client too, but it helps her to feel more calm and centered and present and ready to work. So, you can start that way, but then you start to think about, what does this client need? So you might change the scent between clients because one client needs to be lifted and one client really needs to be calmed. So focusing on symptoms, that's something that we can talk more about later, but that's kind of where we go with this. Now, in addition to having the diffuser, down the road, after you've done a session or 2, and if you know that this person, responds to these scents or appreciates them or is enjoying them, then you can start to use them more one-on-one individually in your treatment. So think about this. Let's say I have, again, my same anxious client. She's come in, she's really worked up today. She's really anxious. She's been, stressed and worried, having nightmares. She's not sleeping. She doesn't feel like she's getting better. She's checking online all the time to see what's wrong with her. She feels like a terrible mother. And it's really hard for her to get the work done that we're trying to do because of this anxiety that's just like in crisis mode, right? So if you have someone that's really worked up, you're trying in therapy, you're trying to calm them down, right? We're trying to calm them enough to be able to talk and to teach them the things that we want to teach them in a way that they can actually respond to and listen to. And a lot of times, that means we have to help them get out of that crisis mode. So what better way than to add in another thing that can work in a different way? So for instance, if I want to calm a client down, and I can say, hey, do you mind if we use a little bit of this essential oil, smell this and see what you think? I think it's, it's supposed to be a restful blend, a grounding blend. It's something that can calm you down. And I would like to use a little bit of this and just have you put it in your palms and just sit and rub your hands together. And I just want to have you sit and inhale this for 5 really deep breaths. Okay. Right. So even just doing that without the oil right now helps me to feel calmer and more centered. So we're introducing them to, hey, when you're in a crisis mode, stop and just breathe. Just breathe. So we're teaching them a skill, but we're adding in this thing that we're doing that helps you breathe more deeply, which is we're trying to really inhale that aroma and get it into our body. And that aroma helps us because of aromatherapy. There is this link between our sense of smell and our emotions, a very strong link. In fact, the essential oils can cross the blood-brain barrier and actually impact our limbic system where our emotions begin and are created. So there is this strong link. And if you think about, just think about the past. If you ever have smelled a certain cologne or perfume that reminds you of an ex from long, long ago, I mean, however many years later you smell that, and it's like, oh my gosh, that brings me right back. Every time I smell Drakkar Noir, I think of boys from 8th grade because that's what they all wore in 8th grade. It was all about that scent. So I still just immediately go back to 8th grade all these years later, right? So our sense of smell is so heavily linked with our memories, with our emotions, how we feel about things. And a smell can make you feel happy immediately, or it can make you feel like, oh, I really hated that time. I hated all those boys and all their Drakkar Noir. Or, oh, they were so cute and they were just smelled so good. That makes me happy, right? So the same thing. So we're having the scent that can create that kind of connection with the olfactory system and with our emotions. And you're introducing that while you're introducing breathing. And as they're breathing the scent, they're actually breathing more deeply and they're focusing on something. They're not even thinking, I'm just breathing. Because a lot of times if we introduce just breathing, that can be difficult. It's like, okay, well, I'm just breathing and then I don't know how to do it and I'm too focused or I'm overthinking it. But no, if I'm just trying to inhale a scent for 5 deep breaths, you actually are breathing. You're also getting that scent into your body that can work in your brain, cross that blood-brain barrier, help to calm you down. Research shows that's actually what these can do. Different ones can do this. And in fact, something like vetiver or sandalwood or cedarwood, these types of oils that work on helping to relax and helping with sleep, they've been shown to work directly on the central nervous system. So it really goes to calm down in that sort of, therapeutic way. And then you've got the behavioral way of we're breathing, we're calming down, and you're doing therapy at the same time, right? So you're teaching them something and then they're calming down and then you can get in there and work in such a deeper way. That's one thing I love about clinical hypnosis. It works in a similar way. It helps you to really go deeper, to relax, to understand things, to learn things on a very much deeper level because you are so relaxed and you're just, able to calm down. Essential oils can work in the same way. So that's kind of, where we get started. And then down the road, we can talk more about, how do I recommend something? Another thing that you might do is just to get started is just have, pick your 2 or 3 or 4 or 5. I have about 8 that I use in my practice and I just line them up on my shelf. I'm in my home practice, or I'd show you right now, but I line them up on my shelf and just have them there. And that way, as we get more into it, clients can pick what they want. And they can say, you know, I really love that. Every time I come here, I want to smell that. Okay, great. I'm going to diffuse that every time you come. And we can work on calming down with this oil, and they can see what they are. You can, we'll talk more in the future in other webinars about how do you help them when they actually want to buy something. And a lot of times they might want to buy something, but from a different brand or from another person or another company. That's totally fine. We're not here to sell oils. We're here to help clients. But also, it's really simple to set up a website for yourself to then send them to if they want to purchase something, so that you don't have to worry about it. That's one way to do it. Another way that I can do it is that I have them for sale in my husband's office, which is right next door to mine. So they can go over there and buy something if they want from the manager of his office. So it's not working directly with me. There's lots of ways we can do this. And yes, I hope you can see that these are ethical, research-based, and that it's another addition to our toolbox. And why wouldn't we include this, especially when the research is so clear that they can be so effective, especially for anxiety, for depression, even on bipolar disorders, even on schizophrenia, helping to create new routines, helping to sleep better, helping with the physical discomfort and pain in pregnancy and postpartum, helping with breastfeeding, increasing milk supply or decreasing milk supply, and helping to soothe the baby and the whole family. So hopefully that gives you just a little bit of how to get started. And if you're interested in getting started and purchasing any products that I've talked about today, you can go to my website, motherhoodessentials.org, and you'll see a link right there that says shop now, and you can go and shop my doTERRA website for all the different products. Also, you can look at my Work With Me tab. Now, this is for those who really know, if you know that you really want to do this and you'd like to use doTERRA brand and you'd like to work directly with me, I would love to have you on my team. I've been putting together this team very carefully with those who are professionals in this field and others that really want to learn and educate and become leaders in this field to help others be able to be educated and to learn how to use these clinically and personally with families. And that's why I call it Motherhood Essentials, because we're talking about essential oils in motherhood, but also it's not just the essential oil. There's so many other essentials that go along with it, like learning how to use these to help us with our sleep, to help us with our nutrition, to help us with our exercise and our mental health and our emotions and all of these different things. So to me, it's this whole big system and pattern that we're working on together on my Motherhood Essentials team. And if you'd like to learn more about that, you can also go to my website. You can go to motherhoodessentials.org and click on the Work With Me tab or join my leadership team. Also on my website, drchristinahibbert.com, you can see a tab that says Work With Me and click on that and get some more information. And I'm happy always to answer questions too through email at Christy, CHRISTI, at drchristinahibbert.com. And that's drchristinahibbert with a CH.com. And hopefully we can connect that way and I can answer any questions. And next time, hopefully we can focus more on answering some more of those specific questions. So feel free to email me your questions, keep in touch, ask me whatever you need. And if you'd like more information about anything we talked about today in this very, very basic beginning, talk about using essential oils in practice, please let me know and I'm happy to continue this discussion with you. So hopefully I'll see you again here next time as we build on this and continue to grow this new tool for ourselves and for our clients, for our families as well. And I'll see you guys later. Okay, bye-bye.